Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Iron overload. Hemochromatosis. Introduction. Hemochromatosis, or iron overload, is a disease in which too much iron builds up in your body. Iron is a mineral found in many foods. Too much iron is toxic to your body. Treatment is needed to prevent the extra iron from damaging organs. This program will help you understand hemochromatosis. It discusses the causes and symptoms as well as treatment options. Hemochromatosis. Iron is an essential nutrient found in many foods. The greatest amount is found in red meat. It is also found in breads and cereals that have iron added to them. In the body, iron becomes a part of hemoglobin. Hemoglobin is a molecule in the blood that transports oxygen from the lungs to all body tissues. Hemochromatosis causes the body to absorb and store too much iron. Your body has no way to get rid of the extra iron. The extra iron builds up in the body's organs and damages them. Without treatment, hemochromatosis can cause the liver, heart, and pancreas to stop working. These organs are where the extra iron is usually stored. Healthy people usually absorb about 10% of the iron contained in the food they eat. People with hemochromatosis absorb up to 30% of the iron. They absorb and store 5 to 20 times more iron than the body needs. Symptoms. Hemochromatosis symptoms may be mild or severe. Not everyone who has hemochromatosis has signs or symptoms of the disease. Women and men may experience the symptoms of hemochromatosis differently. Women are more likely to have general symptoms at first, like fatigue. In men, diabetes or cirrhosis are often the first signs of the disease. Joint pain is the most common symptom of hemochromatosis. Other common symptoms include fatigue, weight loss, lack of energy, abdominal pain, loss of sex drive, heart problems. If hemochromatosis is not found and treated early, iron will build up in the body. This may cause arthritis, impotence in men, early menopause in women, gray or bronze skin, underactive pituitary and thyroid glands, damage to the adrenal glands. Hemochromatosis also causes damage to the heart, liver, and pancreas. The following section looks more closely at the damage extra iron can cause to each of these organs. Too much iron in the liver can cause liver disease. This may include an enlarged liver, liver failure, liver cancer, or cirrhosis. Cirrhosis is scarring of the liver, which causes the organ to not work well. Too much iron in the heart can cause heart abnormalities. These may include irregular heartbeats called arrhythmias and heart failure. Too much iron in the pancreas can damage the organ, which may cause diabetes. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. There are two types of hemochromatosis, primary and secondary. Each type has a different cause. Primary hemochromatosis is inherited. It is caused by a defect in the genes that control how much iron you absorb from food. Primary hemochromatosis is more common. The genes that usually cause primary hemochromatosis are called HFE genes. HFE stands for high iron Fe. Fe is the periodic symbol for the element iron. Faulty HFE genes cause the body to absorb too much iron. You are at risk for hemochromatosis if you inherit 2 copies of the faulty HFE gene, one from each parent. If you only inherit one faulty HFE gene, you are a carrier. Carriers don't usually develop hemochromatosis. However, they can pass the faulty gene on to their children. Secondary hemochromatosis is usually the result of another disease or condition that causes iron overload. Examples of these include certain types of anemia, certain rare inherited diseases, chronic liver diseases. Other factors that can also cause secondary hemochromatosis include blood transfusions, oral iron pills or injections, long-term kidney dialysis. Risk factors. There are some known factors that can increase the chances of developing hemochromatosis. These are known as risk factors. The following slides discuss some risk factors for hemochromatosis. Hemochromatosis is one of the most common genetic diseases in the United States. It is most common in Caucasians of Northern European descent. Primary hemochromatosis is more common in men than in women. Also, older people are more likely to develop the disease than younger people. Men usually develop symptoms between 30 to 50 years of age. Women are usually diagnosed around age 50. Inheriting two faulty HFE genes is a major risk factor for hemochromatosis. However, many people who have two copies of the faulty gene don't develop symptoms of hemochromatosis. Alcoholism is another risk factor for hemochromatosis. Drinking alcohol if you have hemochromatosis may make it worse. A family history of certain diseases and conditions also increases the risk for hemochromatosis. Examples include heart attack, liver disease, diabetes, and arthritis. Diagnosis. Your healthcare provider will diagnose hemochromatosis based on your medical and family histories, a physical exam, and the results from tests and procedures. Sometimes hemochromatosis is diagnosed when checking for other conditions, such as liver disease or diabetes. Your healthcare provider will first ask about your symptoms. He or she will also ask about your personal and family medical histories. A physical exam will be done to check for signs of hemochromatosis. Signs include irregular heartbeat, arthritis, abnormal skin color, enlarged liver. Your healthcare provider may also recommend tests or procedures to diagnose hemochromatosis. Blood tests can help your healthcare provider find out how much iron is in your body. Blood tests may also check for liver damage. Liver damage may be a sign of hemochromatosis. An MRI may also be done to show how much iron is in your liver. It uses strong magnets to create images of the inside of the body. Another test that may be done to diagnose hemochromatosis is a liver biopsy. During this procedure, your healthcare provider uses a needle to remove a small sample of liver tissue. The tissue is examined under a microscope to determine how much iron is in your liver. Genetic testing may also be done to diagnose hemochromatosis. Genetic testing can show whether you have one or two faulty HFE genes. However, some people with two faulty HFE genes don't develop the symptoms of hemochromatosis. People with hemochromatosis or a family history of it may want to consider genetic testing and counseling. Testing will help show whether one or both parents have faulty HFE genes. A genetic counselor can figure out the likelihood of your children having hemochromatosis. Treatment. The goals of treating hemochromatosis are to reduce the amount of iron in your body to normal levels, prevent or delay organ damage from iron overload, treat complications of the disease, maintain a normal amount of iron in your body for the rest of your life. A common treatment for hemochromatosis is therapeutic phlebotomy. Therapeutic phlebotomy is a procedure that removes blood from your body. This also removes the iron found in the hemoglobin in the red blood cells. During therapeutic phlebotomy, a needle is inserted into a vein. Your blood flows through an airtight tube into a sterile container or bag. The process is similar to donating blood. Often, therapeutic phlebotomy will need to be continued for the rest of your life. You'll also need frequent blood tests to check your iron levels. Iron chelation therapy is another treatment option for hemochromatosis. Iron chelation therapy uses medicine to remove excess iron from your body. The medicine used in iron chelation therapy is either injected or taken by mouth. This treatment is a good option for people who can't have therapeutic phlebotomy. Your healthcare provider may also suggest you change your diet as a part of treatment. The next few slides discuss dietary changes for people with hemochromatosis. If you have hemochromatosis, you should avoid taking iron. This includes iron pills, iron injections, or multivitamins that contain iron. Also, limit your intake of vitamin C. Vitamin C helps your body absorb iron from food. This can make hemochromatosis worse. Avoid uncooked fish and shellfish. Some fish and shellfish contain bacteria that can cause infections in people with certain diseases like hemochromatosis. Alcohol should also be avoided or limited. Alcohol use can worsen liver damage from hemochromatosis. Your healthcare provider may also prescribe treatments for any complications. Possible complications of hemochromatosis include liver disease, heart problems, or diabetes.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Hemochromatosis, or iron overload, is a disease in which too much iron builds up in your body. Iron is a mineral found in many foods. Too much iron is toxic to your body. Hemochromatosis symptoms may be mild or severe. Not everyone who has hemochromatosis has signs or symptoms of the disease. There are two types of hemochromatosis, primary and secondary. Primary hemochromatosis is inherited. Secondary hemochromatosis is usually the result of another disease or condition. Your healthcare provider will diagnose hemochromatosis based on your medical and family histories, a physical exam, and the results from tests and procedures. The most common treatment for hemochromatosis is therapeutic phlebotomy. Other treatment options include medicines and changes to your diet. Treatment is needed to prevent the extra iron from damaging organs. Getting diagnosed and treated early can help prevent damage to your heart, liver, and other important organs. Thank you for using Explain.